My name is Dr. Tendoh Timoh. I am an advanced cardiac imager for Cape Cod Healthcare and the director of the Advanced Cardiac Imaging Lab. For Cape Cod Healthcare, we have multiple imaging modalities depending on the questions that need to be answered by the referring physicians, starting with the most or the least invasive being echocardiography. We answer valvular questions, we answer questions related to the pumping function of the heart, and then moving more towards anatomic diagnosis where we look at nuclear imaging and coronary CT scans. Nuclear imaging involves radiation, and it's not something that is readily available to every patient, but it's a good imaging modality that we also offer at Cape Cod Healthcare that can look at blood flow to various areas of the heart in order to determine degree of stenosis of blood vessels that are affected. Another better, I would say, non-invasive method is to look directly at the coronary arteries, which non-invasively is cardiac CT. Not only can we look at the coronary arteries non-invasively, but we can also determine the flow within those coronary arteries by something called CT-FFR. So that's another great imaging modality that we offer here at Cape Cod Healthcare. And then the most interesting to me is cardiac MRI, which not only can tell you anatomic diagnosis, but really looks specifically at the muscle of the heart to tell you different pathologies that can affect the heart muscle, not only related to coronary disease, but to infiltrative diseases and cardiac masses. So as an overview, those are the 4 imaging modalities that we readily offer here at Cape Cod Healthcare. In terms of what inspired me to go into cardiac imaging, it's I like to answer questions. I like mysteries. So, I tried every different modality. I was actually a surgical intern. I was supposed to go to residency for surgery. I ended up doing a cardiology rotation just because it was close to my home at Emory. And then I fell in love with cardiology, and I like the aspect of searching for an answer, giving my colleagues the underlying diagnosis, and then making treatment plans based on those imaging modalities. So it just sort of fell into my lap. I never started out saying I was going to be a cardiac imager. I think it's a relatively new field in terms of to be so specific to a discipline, but it just sort of fell in my lap, and I like the whole idea of things being a mystery and then slowly being solved. The role of cardiac imaging almost serves as a secondary role. We help patients that are referred by their primary physicians for different diagnoses to either rule in those diagnoses or guide them along a different path. Normally, a patient would see an outpatient cardiologist and will have a specific issue and a question that needs to be answered. They would then be referred to us for advanced imaging modalities where we either confirm the underlying diagnosis as suspected by their referring physician, or we suggest an alternate diagnosis based on the testing that is performed within Cape Cod Healthcare.